Welcome back. A new case of Ebola emerged in Liberia on Friday. This is a setback for the country declared free of the disease on September 3rd and for the region, which is struggling to end an epidemic that has killed more than 11,000 people. Liberia's Minister of Health, Banish Dan, says the patient is a 10-year-old boy who lived with his parents and 3 siblings in Painesville, a suburb of east of the capital, Monrovia. All 6 family members, as well as other high-risk contacts, are in care at an Ebola treatment unit. Now, the 10th International Conference on Cancer in Africa is taking place in Morocco. The conference, whose theme is Roadmap to Cancer Control in Africa, is organized by the African Organization for Research and Training in Cancer. Africa 54 health correspondent Linord is attending the conference and now joins us on the phone from Marrakesh. Hello, Linord.
Hello, Vincent.
Yes, first tell us what are some of the topics that were discussed today?
Several topics were on the agenda today, including breast cancer. They presented several studies that were conducted in various countries such as Nigeria, Ghana, and Sudan. Also, topics were around the incidence of the disease, progression, treatment, and cultural and social impact of cancer control in general in Africa. Another topic is malignancies in the setting of HIV/AIDS infection. In other words, looking at cancers that can develop with HIV/AIDS, including cervical cancer and Kaposi sarcoma, which is a cancer that usually develops on the skin.
So what are experts saying? What are the challenges, especially in dealing with this HIV-related cancer?
Well, there are several challenges that they mentioned, but specifically a few of them, they talked about a better understanding of the link between HIV and cancer is needed and necessary for the improvement of care of HIV-infected subjects, among other things. There's also the need to implement well-designed population-based study in order to better describe the spectrum of AIDS-associated malignancies, as they say, and the most effective strategy for the prevention, screening, and treatment, as well as understanding the mechanism of cancer occurrence in the general population.
I also know that you've been talking to experts and officials there. Who did you speak to and what are they telling you?
So I spoke to several people, including Mr. Arnold Vasquez, who is a board scientific officer of the American Cancer Society. What I wanted to mention is Dr. Christopher Wild, who is the director of the International Agency for Research on Cancer, a division of the WHO. He talked about the priorities for research on cancer in Africa based on 3 broad areas. He said that first, the need to understand the burden of cancer in Africa is a reality, and one of the issues he mentioned is the need for accurate figures, which lack in many cases, understanding number of cancers and the type of cancers in each country. And also, he talked about understanding the causes of cancer in Africa, as the continent may have different risk factors. For example, infections are responsible for 1 in every 3 cancers in Africa. That's what he says. And he says that this gives the indication as to what intervention should be used. And the third aspect he talked about is also based on that knowledge, is studying what is effective in preventing cancer or detecting it early.
Now, I don't know if this has been discussed, but for a long time people didn't realize there was widespread cancer infections in Africa. What are the experts saying? Is it that we are getting to know more, or that actually the cases are just increasing?
You know, what we hear a lot is the fact that cases are increasing because of lifestyle changes. They talk about Western lifestyle, and when I ask, what do you mean by Western lifestyle? They say, you know, nowadays people have more access, for example, to car. They don't walk so much anymore. People have access to fast food, such as French fries and other things. And,
you know.
Yes, so these are some of the reasons.
Thank you. We'll continue this conversation another time. Thanks a lot, Linord. Africa 54 health correspondent Linord reporting from Marrakesh in Morocco.